have finished frontoparieto-occipital region, as I remember, yeah? Temporal region, we have not started. Who attended lecture last week? We start cerebral part of the head, yeah? We have finished frontoparieto-occipital region and we have not started temporal region, yeah? The cerebral part of the head of the fornix, which consists of what? 3 regions: frontoparieto-occipital region, temporal region, and mastoid process region. Frontoparieto-occipital region we have finished, and we are continue now following region of the fornix, temporal region. Temporal region is bounded superiorly by superior temporal line. Inferiorly, it is bounded by xiphoid process and by frontal process of the zygomatic bone. So this is frontal process of the zygomatic bone inferiorly. So it is bounded by zygomatic arch, and superiorly it is bounded by superior temporal line. Soft tissues of the temporal region consist of the following layers: skin, subcutaneous fat tissue. Below subcutaneous fat tissue, we have on this region superficial fascia. Below the superficial fascia, on the picture is shown the temporalis fascia. This is temporalis fascia, which is continuation of the galea aponeurotica of the frontoparieto-occipital region. What we have told that muscular layer of the frontoparieto-occipital region, these two muscles, frontalis muscle and occipitalis muscle, are connected to each other by galea aponeurotica. This galea aponeurotica to the temporal region continues to the temporalis fascia. Temporalis fascia, which is divided into superficial layer, this is superficial layer of temporalis fascia, which is attached to the outer surface of the zygomatic arch, and it consists of deep layer, which is attached to the inner surface of the zygomatic arch, and between these two layers is located also connective tissue space. So first fat connective tissue space we have on this region below the skin. Second fat connective tissue space is located between the layers of the temporalis fascia, which is closed space. So here, if spreads any inflammatory process in this fat connective tissue layer, it is limited. It can't be spread to other region fat connective tissue layer. Below the temporalis fascia, is located subaponeurotic space, subaponeurotic fat connective tissue space, which is third fat connective tissue space of this region, which down is communicated to the fat of the infratemporal fossa, which is located below the zygomatic arch. So here, if in this fat connective tissue layer spreads inflammatory process, it down from the temporal region can spread to the infratemporal fossa. Below subaponeurotic layer is located muscle on this region, temporalis muscle, which is masseter muscle, It originates from inferior temporal line and is attached to the coronoid process of the mandible. It occupies the temporalis fossa, which down is also communicated to the infratemporal fossa by its connective tissue layer. And below temporalis muscle, on this region, we have bone, which is covered by the periosteum, and bone of the temporal region consists only two compact bone layer, lamina externa and lamina interna. There is no diploid layer in the temporal bone. So we have told that bone of the frontoparieto-occipital region consists of which layers? 3 layers, yeah? Lamina externa, interna, and between them is located diploid layer. But in temporal bone, there is no diploid layer. So that's why it's more thin, the temporal bone, than bone of the frontoparieto-occipital region, and under the temporal bone, so in the lamina interna, is closely attached the middle meningeal artery. And this is middle meningeal artery, so which lies where? In the cranial cavity, trunk of the middle meningeal artery, anterior and posterior branch of the artery, which so closely is located to the inner surface of the bone that it forms on the bone the sulcuses. So that's why trauma of the temporal bone is most dangerous. Why? Because is chance to damage, more chances to damage the middle meningeal artery, which is very closely located to the inner surface of the bone. This artery supplies the dura mater. Origin of this artery, look, it is branch of the maxillary artery, which comes from external carotid artery. And it enters the cranial cavity by foramen spinosum. So comes from maxillary artery, middle meningeal artery, which by foramen spinosum, which is located in the middle cranial fossa, enters the cranial cavity and lies under the temporal bone trunk of the artery, where it is divided into anterior and posterior branches. These are branches passes into the layers of the dura mater and provides blood supply of the dura mater. Projection point of the middle meningeal artery, trunk and anterior and posterior branches of this artery is used the Cronlane's scheme. This is Cronlane's scheme, which is marked on the scheme, horizontal lines and vertical lines, two horizontal lines, superior and inferior horizontal line, anterior, middle, and posterior vertical lines, and intersection of these lines shows us the projection point of the trunk, anterior and posterior branches of the middle meningeal artery on the scheme. How is formed this scheme? Inferior horizontal line passes from inferior margin of the orbit. I will see on the picture. It starts from inferior margin of the orbit along the zygomatic arch. Superior horizontal line passes from superior at the level of superior margin of the orbit and parallel to the inferior horizontal line. Anterior vertical line passes from midpoint of the zygomatic arch, above crosses superior horizontal line. Middle vertical line starts from the temporomandibular joint, passes and crosses both horizontal lines. Posterior vertical line starts from the apex of the mastoid process, upward crosses both horizontal lines. So by these two horizontal lines and 3 vertical lines, we get the intersections, which shows us the projection point of the arteries, branches, and trunk of the artery. Trunk of the middle meningeal artery is located in the point of the intersection of the inferior horizontal line and anterior vertical line. So where here is located the trunk of the middle meningeal artery. Anterior branch of the middle meningeal artery is located in the point of the intersection of the superior horizontal line and anterior vertical line. So here. Posterior branch of the middle meningeal artery is located in the point of intersection of the superior horizontal line and the posterior vertical line. So this intersection of the lines shows us the projection point of the branches and trunk on the skin of this artery. We have told the layers of the temporal region. Superficial tissues of the temporal region is supplied by superficial temporal artery. We have told that superficial branches are located where in subcutaneous that tissue. Blood supply of the skin of this region is formed by superficial temporal artery, which is branch of the external carotid artery. Artery is accompanied by same named vein, superficial temporal vein. Sensory innervation of the skin of the temporal region is formed by auriculotemporal nerve, which is branch of the mandibular division of the trigeminal nerve, and zygomaticotemporal nerve, which is maxillary division of the trigeminal nerve. So skin of this region is supplied by auriculotemporal nerve and zygomaticotemporal nerve. But deeply, we have told that is located what? Muscular layer, yeah? Muscular layer is supplied by different arteries and different nerves. We see blood supply of the temporalis muscle is formed by deep temporal arteries. These are deep temporal arteries which consist of anterior and posterior branches. This artery comes from maxillary artery, from external carotid artery, and innervation of the temporalis muscle is formed by same named nerves, deep temporal nerves, where we have also anterior branch and posterior branch, which comes from mandibular artery. So temporalis muscle is supplied, I repeat, by deep temporal arteries and deep temporal nerves. Lower anterior part of the head consists of the facial part of the head. Yeah, one moment, I share now new presentation. Pictures?
Yes.
So lower anterior part of the face is facial part of the head. Facial part of the head, which is bounded superiorly by the line which passes to the superior margin of the orbit along the zygomatic arch and to the apex of the mastoid process, and down it is separated from the neck region by the line which passes to the lower margin of the mandible. Face is divided into anterior part and lateral part. anterior part and the lateral part. In anterior part, we have different regions. We have orbit region, we have nasal region, we have infraorbital region, we have oral region, mental region, and also buccal region, and in the lateral part of the face, on this picture is well shown, we have masseteric region, which is located more superficially and deeply in the lateral part of the face. We have deep region of the face. We study only lateral part of the face. These are parotid masseteric region. Also, we explain buccal region, and we study deep region of the face. Before we start explaining the lateral part regions of the face, let's talk about layers. Which layers we have on the face? Skin of the face is thin and movable. We have told that skin of the cerebral part of the head is what? Is skin and less movable, yeah? But skin of the face is more thin and more movable. Under the skin, we have subcutaneous fat tissue. Below the subcutaneous fat tissue is located superficial fascia. Superficial fascia, which covers superficial vessels, nerves and veins of the face, and these vessels, which is located superficially under the superficial fascia, are superficial temporal artery, are transverse facial artery, which is branch of the superficial temporal artery, facial artery, posterior auricular and occipital artery, which comes from the external carotid artery. Arteries are accompanied by same named veins. So superficially under this fascia, we have facial vein, we have transverse facial vein, we have superficial temporal vein, we have retromandibular vein, posterior auricular and occipital vein. Superficial nerves, which is located under the superficial fascia, are branches of the trigeminal nerve. So sensory innervation of the skin of the face is formed by the branches of the trigeminal nerve, which comes from ophthalmic division, maxillary division, and mandibular division. From mandibular division, we have mental nerve, buccal nerve, auriculotemporal nerve. From maxillary division, zygomaticofacial nerve, zygomaticotemporal nerve, infraorbital nerve, and from ophthalmic division, we have supraorbital and supratrochlear nerves. We have told these nerves innervates what? Anterior part of the skin of the frontal parieto-occipital region. Also from this division comes infratrochlear nerve. So sensory innervation of the skin of the face is formed by branches of the trigeminal nerve. Except these superficial vessels and nerves, under the superficial fascia on the face is located muscles of facial expression. Muscles of facial expression. Muscles of facial expression, which is divided into two groups, are muscles of facial expression, which originates from the bone and is attached to the soft tissues, and are muscles of facial expression, which originates and is inserted through the soft tissue. So origin is from soft tissue and the attachment is through the soft tissue. Such muscles are orbicularis oculi muscle and orbicularis oris muscle. From this group of the muscles of facial expression also takes part muscles of the cerebral part of the head and also muscles of the neck region. For example, platysma muscle, which starts from the outer surface of the clavicle, and its fibers are attached to the lower margin of the mandible, and its fibers passes on the facial part of the head, and frontalis muscle also, which is originates from the facial part, and also it lies through the cerebral part of the head. From this group also are zygomaticus minor muscle, zygomaticus major muscle, levator labii superioris muscle. So all these muscles of facial expression lie superficially under the superficial fascia. But more deeply on the face, we have deep fascia, proper fascia of the face, which is divided into two layers, superficial layer and deep layer. And this deep fascia covers different structures, and which we explain into the regions, but also this fascia covers deep muscles, and deep muscles of the face are muscles of mastication. Muscles of mastication, we have four pairs of muscles. These are lateral pterygoid muscle. These are lateral pterygoid muscle, which originates from the pterygoid process of the sphenoid bone, and its fibers are inserted into the articular disc. Medial pterygoid muscle, which also originates from this pterygoid process of the sphenoid bone and is attached to the inner surface of the angle and the ramus of the mandible. Temporalis muscle, we have told, is also the masseter muscle. Yeah, we have told it originates from what? Inferior temporal line, and is attached to the coronoid process of the mandible on both sides. And muscles of mastication, we have also the masseter muscle. Yeah, masseter muscle. This on this picture is shown, and this is masseter muscle. This is one of the muscle of mastication, which is attached to the outer surface of the ramus and the angle of the mandible. So it originates from the zygomatic arch and is attached to the outer surface of the angle and the ramus of the mandible. So more deeply on the facial part of the head, we have what? These muscles of mastication. We have told that lateral part of the face, we have more superficially what? Parotid masseteric region. Yeah, this is parotid masseteric region, what we see on the picture, which is bounded superiorly by zygomatic arch. Anteriorly, it is bounded by anterior border of the masseter muscle. Inferiorly, it is bounded by lower margin of the mandible, and posteriorly, it is bounded by mastoid process and by the muscle, which is anterior border of the sternocleidomastoideus mastoideus muscle, which originates from the mastoid process. Parotid masseteric region, anterior part is composed of the masseter muscle, posterior part is composed of the parotid gland. This is parotid gland. Parotid gland is located in the retromandibular fossa. This is retromandibular fossa. Retromandibular fossa, which is bounded anteriorly by ramus of the mandible, also by medial pterygoid muscle. Medial pterygoid muscle is not shown on this picture, but we have told that it is attached to the inner surface of the angle and the ramus of the mandible. Yeah. So anterior border of the retromandibular fossa will be ramus of the mandible, medial pterygoid muscle. Posteriorly, it is bounded by mastoid process. Superiorly, it is bounded by external acoustic meatus, and inferiorly, fossa is bounded by posterior belly of the digastric muscle. Parotid gland is located in this fossa, but it does not occupies only the fossa. It may extend anteriorly to the masseter muscle. It may extend down to the lower margin of the mandible or above through the zygomatic arch. Parotid gland is covered, it's salivary gland, yeah? It is covered by parotid fascia. Parotid fascia, which is part of the superficial fascia, of the superficial layer of the deep fascia of the face. We have told that the deep fascia of the face, proper fascia of the face, is divided into what? Superficial layer and deep layer, yeah? Superficial layer of the proper fascia, which covers the parotid gland, that part of the fascia is called the parotid fascia. It originates from the zygomatic arch, covers the parotid gland completely, but medial surface of the this fascia is more thin, which gives off the process. And this process of the fascia extends to the lateral wall of the pharynx. Clinically, this is important because when there is so this fascia is thick in other parts of the gland where it covers, but it gets more thinner to the medial surface where it gives off process, and this process extends to the lateral wall of the pharynx. So clinically, why it is important? Because that's why during the parotitis, when there is inflammation of the gland, inflammatory process may be spread from the parotid gland through the lateral wall of the pharynx and also to the tissues which surrounds the external acoustic meatus. In the parotid gland, it forms the capsule which closely covers the gland, so closely that during surgery, when it is needed intracapsule excision of the gland, it is impossible technically. In the parotid gland passes the following structures: facial nerve, retromandibular vein, and superficial temporal artery. So structures which is located through the parotid gland are retromandibular vein, superficial temporal artery, and facial nerve. Facial nerve is shown on this picture. Let's start from the facial nerve, origin of the facial nerve. Facial nerve is cranial nerve. It is 7 cranial nerve, which leaves cranial cavity by stylomastoid foramen. So when it leaves the cranial cavity by stylomastoid foramen, it passes into the parotid gland where it forms the plexus, and it is divided into 5 branches, which radially passes on the face. It gives off temporal branch, it gives of zygomatic branch, it gives of buccal branch, it gives of marginal mandibular branch, and it gives of cervical branch. All these branches of the facial nerve supplies muscles of the facial expression, muscles of the facial expression. That's why if this nerve is damaged surgically or accidentally during trauma, there is developed paralysis of the face. These branches in anterior part of the face is located more superficially. It lies through the muscles of facial expression in anterior part of the face. But in posterior part of the face, or more laterally, these nerves are located deeply through the parotid gland. So during surgery, surgeon must know that in anterior part of the face, if here is done surgical intervention in anterior part of the face, not to damage these branches, because where it lies under the superficial fascia. And that's why during surgical intervention of the face, incision which is formed on the face is radial incision. Radial incision is performed on the face, which corresponds the location of these branches without damaging of these nerves. Also superficially, in parotid masseteric region, we have transverse facial artery. Transverse facial artery, which is branch of the superficial temporal artery. This artery, transverse facial artery, supplies the superficial tissues of the parotid masseteric region. Structure which passes in the parotid gland is also which artery? Superficial temporal artery, we have told you. So superficial temporal artery is branch of the external carotid artery. This is external carotid artery, which is located where? In the carotid triangle. So external carotid artery, when it leaves the carotid triangle, it passes into the parotid gland, and in the parotid gland it gives off the last branch, which is superficial temporal artery, which crosses the zygomatic arch and enters the temporal region and supplies the superficial tissues of the temporal region. But here on this level, it gives off transverse facial artery, which supplies superficial tissues of the parotid masseteric region. In the parotid gland also is located, we have told what? Retromandibular vein. And this is retromandibular vein, which is present in the parotid gland. Structure which comes from the parotid gland is the parotid duct. Parotid duct, which when comes from the parotid gland, it crosses superficially the masseter muscle, enters the buccal region. In the buccal region, it pierces the buccinator muscle and opens in the oral vestibule opposite the second upper molar teeth. So in anterior part of the parotid masseteric region, parotid gland is also located superficially, so where above the masseter muscle, above the masseter muscle. Projection point of the parotid duct on the skin is in the midpoint of the line which connects the tragus of the ear to the wing of the nose. So if we take the line and pass from tragus of the ear to the wing of the nose on the skin, in the midpoint of the line is the projection point of the parotid duct. So surgeon must know that if on this area is done the surgical intervention, that parotid duct here is located superficially, superficially. Do we understand?
Yes, Professor.
Yes.
Anterior part of the face, anteriorly to the parotid mesenteric region, is located the buccal region. Buccal region. This is buccal region. Buccal region, which is bounded superiorly by lower margin of the orbit, inferiorly by lower margin of the mandible, posteriorly anterior border of the masseter muscle. Buccal region, we have the following layers: skin, subcutaneous dead tissue, superficial fascia. Under the superficial fascia, in the buccal region, passes facial artery and facial vein, and nerve which is located here is buccal nerve from the mandibular division of the trigeminal nerve. So sensory innervation of the skin of this region is provided by the buccal branch from the mandibular nerve. Vessels which is located here are facial artery and facial vein. Facial artery is branch of the external carotid artery. So facial artery, when originates from the external carotid artery, it passes on the neck in submandibular region, then it crosses the lower margin of the mandible, passes anteriorly to the anterior border of the masseter muscle, like tortuous path. It passes under the fibers of the masseter muscle, platysma muscle. This is platysma muscle, which is attached to the lower margin of the mandible. And it gives off branches on the face, superior, inferior labial arteries, passes under the zygomaticus minor and major muscle. It's the lateral border of the nose, it gives off lateral nasal artery, and it continues to the angular artery. So angular artery is continuation of the facial artery. Artery is accompanied by facial vein. Facial vein, which is, look where is formed, it is formed supraorbital and supratrochlear vein, which drains blood from the anterior part of the frontoparieto-occipital region. These two veins joins and forms the angular vein. Angular vein down continues to the facial vein. So angular vein is formed by supraorbital and supratrochlear vein, and down it continues to the facial vein, which drains blood from this part of the face, and when it leaves the face, it drains into the internal jugular vein. Facial vein by deep facial vein is communicated to the pterygoid venous plexus, and by superior ophthalmic vein it is communicated to the cavernous sinus through the cranial cavity. This is way of spreading of infection from superficial tissues of the face deeply to the deep region of the face, and by superior ophthalmic vein through the cranial cavity. This is deep facial vein, what we see, and this is pterygoid venous plexus. So, main vein of the deep region of the face is pterygoid plexus. So, to the pterygoid plexus, it is communicated by deep facial vein. Projection point of the facial artery, projection point of the facial artery on the skin passes on the line which is passed from the intersection of the line which is formed by anterior border of the masseter muscle to the inferior border of the mandible through the medial surface of the orbit. So, on this line is located projection line of the facial artery on the skin. Below the superficial fascia, we have deep fascia of the face, proper fascia of the face, which covers here deeply the buccinator muscle is located. Deeply buccinator muscle, above it is located buccal fat pad, which is more developed, this fat connective tissue layer on this region. So mostly fat connective tissue layer is developed in the buccal region, which is called buccal fat pad. And through this buccal fat pad is located the parotid duct, what we have told. So parotid duct, when crosses the masseter muscle, it at first dives in this buccal fat pad and then pierces the buccinator muscle. Buccinator muscle, which is supplied by the branches of the maxillary artery and by buccal nerve from mandibular division of the trigeminal nerve. More deeply in a lateral part of the face, we have not much time, but I start now deep region of the face and main topics I will tell you about deep region, what you must pay attention. Deep region, we have told, is located deeply through the lateral part of the face. Yeah, so deep region of the face lies between pterygoid muscles, lateral medial pterygoid muscle, mandible, and the maxillary bone. Main vessels and the nerves of the deep region are maxillary artery, pterygoid venous plexus and maxillary vein, and mandibular nerve, trunk of the mandibular nerve. Now let's start from the artery. Maxillary artery, so main artery of the deep region of the face is maxillary artery. Maxillary artery, which is branch of the external carotid artery. So external carotid artery, we have told when it passes through the parotid gland, it gives off what? Last branch, superficial temporal artery. Yeah? Also here it gives off maxillary artery, which passes in the deep region of the face. And according to its location, artery is divided into three parts: mandibular portion, pterygoid portion, and the pterygopalatine portion of the maxillary artery. Mandibular portion of the maxillary artery gives off branches for the teeth of the mandible. We don't need these branches. But also it gives off the middle meningeal artery, what we have told, middle meningeal artery, which supplies the dura mater. So middle meningeal artery arises from the mandibular division of the maxillary artery and after to the foramen spinosum and enters into the cranial cavity. Pterygoid portion of the maxillary artery is located on the pterygoid muscles. Look, this is pterygoid portion, which gives off branches for muscles of mastication. It gives off deep temporal arteries. It gives off masseter artery. It gives off buccal artery, so deep temporal artery for temporalis muscle, lateral pterygoid artery for lateral pterygoid muscle, medial pterygoid artery for medial pterygoid muscle, and masseteric artery for masseter muscle. Also, it gives off buccal artery for buccinator muscle, but this buccal artery also supplies the mucosa of the maxillary bone. And pterygoid portion, pterygopalatine portion. Look, pterygopalatine portion of the maxillary artery is located through the pterygopalatine fossa. This pterygopalatine fossa is located medially to the deep region of the face, which gives off branches for the teeth of the upper jaw. It also gives off infraorbital artery. This infraorbital artery supplies superficial tissues of the anterior part of the face. So, main artery of the deep region is the maxillary artery. Main veins of the deep region of the face is what? Pterygoid venous plexus. This is pterygoid venous plexus, which is formed by the union of the different veins. This venous network is located more superficially in the deep region of the face. I will say more superficially we have what? Pterygoid venous plexus, and behind the plexus is located the maxillary artery. Pterygoid venous plexus is communicated to the facial vein by deep facial vein, to the cavernosus sinus by superior ophthalmic vein. These are ways of the spreading of the inflammatory process from the deep region of the face through the cranial cavity. From pterygoid venous plexus comes short veins. These are maxillary veins. Maxillary veins which connect to the superficial temporal vein, and it forms the retromandibular vein. So deep veins which drains blood from the deep region of the face, I repeat, is pterygoid venous plexus and is the maxillary vein. Nerve, which is located in the deep region of the face, is the trunk of the mandibular nerve. We see trunk of the mandibular nerve. So mandibular nerve is division of the trigeminal nerve. It when leaves the cranial cavity by foramen ovale, so it passes in the deep region of the face where it is divided into anterior division and posterior division. Anterior division of the mandibular nerve gives off most muscular branches. Posterior division of the mandibular nerve gives off mostly sensory branches. Only one motor branch arises from posterior division. This is mylohyoid nerve. So muscular branches of the anterior division are deep temporal nerves, are lateral pterygoid nerve, buccal nerve, deep temporal nerve for temporalis muscle, masseter nerve for the masseter muscle, buccal nerve for the buccinator muscle, but medial pterygoid nerve arises from the trunk of the mandibular nerve. Posterior division gives off most sensory branches, we have told. These are auriculotemporal nerve. Auriculotemporal nerve, we have told it is a nerve which supplies the skin of the temporal region. A look, origin of this nerve consists of two parts. It surrounds the middle meningeal artery and then becomes as one branches. And this nerve passes where? Through the gland. It supplies the parotid gland, also tissues of the external acoustic meatus, and then enters the temporal region and provides sensory innervation of the skin of the temporal region. Also, from posterior division comes the inferior alveolar nerve, which supplies the teeth of the mandible, and before it enters the mandibular foramen, it gives off one motor branch. These are mylohyoid nerve. Sensory branch which arises from this division is the lingual nerve. So mostly anterior part division gives off muscular branches, posterior division gives off sensory branches. Do we understand?
Yes.
Very good.